Hey, New York City, I am Vanessa Figueroa, a member of UAU Count Me In team / Census team here in Staten Island. I'm going to be touching part of our resources of the census and the health of our communities and how it affect with this year 2020 census. As you may know, since 1790, every 10 years, everyone gets counted in the United States. And that includes from the future generation that are newborns to our older and wise generation. In part one in this presentation, I'll be discussing how the census affects children. You will be learning how children get undercounted, which is definitely unacceptable for this year's census. You will also learn how different programs that children rely on based on census data for resources. What does the census do for us? It is critical because more than $675 billion in federal funding is distributed to states across the USA and communities each year based on census data. Monies which are needed for programs that help you and your loved ones. Did you know such program is based on census data all affect in nutrient assistance, health insurance, program like Head Start, special education programs, and foster care. When children are missed in the census, these programs miss out on funding that is based on the number of people being counted. Our future generation got undercounted based on data from 10 years ago in 2010. Based on the chart, children under the age of 5 are least likely to be counted in the census. And that is over 1 million less than the estimated totals from 2010. From this chart is demonstrating that there was 21 million birth records from 5 years leading to 2010 census, showing that one box is 100,000 people. So as you see here in this diagram, one box is 100,000 people. Now subtract that number to 154,000 death records, and now adding 240,000 net international immigrants. We should have the total of 21,206,000 children counted in the census, but only 1 million children got undercounted. This estimated of 4.6% of children being undercounted are newborns, babies, toddlers, and young children in daycare or pre-K programs. And to understand what ethnicity does get undercounted, it's known fact that is more young Black and Hispanic children are more likely to be undercounted than white children. Showing how many kids get undercounted, now it's time to understand why they do. People who move around Census Day are at high risk of being undercounted. This trend science makes it hard to count children. For example, kids that are living with grandma for a little while until mom gets back on her feet, but then grandma forgot to count the children when the census questionnaire hits her mailbox, just because the kids were just staying with them temporarily. Why else do kids get undercounted? Complex households. Whoever household that is filling out the census may leave off young children who live with them or may be staying with them temporarily, and this most often in so-called complex households. For example, those who with multiple generation of family like niece, nephew, cousin, great-grandkids, unrelated families that are living together, and blended or foster families, which can be conflicting and confusing for some households. In 2010 census, about 40% of all young children fell under the complex household category, according to the Census Bureau. Important thing to remember is wherever you sleep the most is where you should be counted, no matter what the scenario is. They all matter and they all count. Another reason why kids get undercounted is, according to the Census Bureau, children that are living in homes in poverty or adults that have limited English speaking skills are most likely to be missed in the census. It's an important thing to remember as well. The census provides 13 languages for you to understand and to feel more comfortable. No matter how you live, or if you don't speak English, you do count. Another reason why kids get undercounted is fear. Simply just because people don't know what is the census and can feel that it will mess with their own benefits that they receive, or there's supposed to be a certain amount of people living in the home and they may fear the census will probably get them into trouble, which is false because the census is protected by law by Title 13, which means is no information is allowed to be shared with no one. So it's not used against you. And another reason why kids get undercounted, sometimes parents just make mistakes. Simply that most often people who do return the forms just forget to count everyone that's under the roof. It's time to understand what affects programs, tools, and resources when children gets undercounted. Census data are dependent for providing such programs like free and reduced price school lunches, which provide food assistance, especially for children that depends on meals to have these nutrition. Programs like special education, especially for children with disabilities or have learning disabilities. It affects classrooms technology and class size reduction. It affects programs like Head Start, which provide your children to learn, to play, to build skills, to get them ready for kindergarten and beyond. It affects programs like after-school programs and summer camps. If your community is undercounted, your children can miss out special activities to discover their hidden talents and to stay active and to stay healthy. Now shifting to our seniors. In this part, we're going to be seeing how the census affects the seniors. We're going to see types of programs that seniors take advantage of that connects with the census. As well, we're going to see some benefits not only the seniors take advantage of, but children too. How does the census affect our seniors? Community programs through our local on aging that are funded by the census include caregiver assistance and support programs, respite care, telephone reinsurance, check-in, transportation, such as Accessoride, adult protection services, health promotion, and disease prevention educational programs, and nutrition programs, and so many more. Why does seniors go undercounted? Since this year is our first time completing the form online, 56% of seniors says they are not comfortable doing it online, which is fine. You still have an option to still fill it out by paper. And again, as I mentioned earlier, all the information that is being received to the Census Bureau is protected by law. You can be sent up to 5 years in prison and be fined to $25,000 for violating any information given to the census. Seniors goes undercounted, especially for senior who just had surgery and was admitted in the nursing home for a short term for rehab, which can last for a few months, but they are counted in their usual residence instead of the facility. However, if patients report that they do not have a usual home elsewhere, they will be counted at the facility. On the other hand, people living in long-term healthcare facilities, such as skilled nursing homes, are counted at the facility, where they sleep and live the most of time. Patient and psychiatric hospitals or units at hospitals are counted in the facility, regardless of whether they stay in short or long term. Assisted living or skilled nursing facility, such as nursing home, all fall in group quarters living arrangements, which means seniors do not have to worry about doing the census because Their facility will assist in making sure you are being counted. I'm going to be touching on health insurance and benefits, which applies not only to seniors, but also to children. I believe it's important from children to seniors to have the proper coverage, especially when it comes to health and nutrition. It's best to know who needs this type of assistance and not have any special benefits be taken away. The Healthcare Cost and Utilization Project, which also relies on census data, measures health-related factors such as income, housing, age, race, and many more, is important because these databases enable research on a broad range of health policy issues, including costs and quality of health services, medical practice patterns, access to healthcare programs, and outcome of treatments at the national, state, and local levels. Billions of dollars of federal money is guided by census data, and it helps programs with health-related that you may be familiar with. Children Health Insurance Program, Medicaid, community health centers, Medicare, and SNAP benefits. I'm going to be using SNAP as an example, which many of you know as a nutrition assistance that many people rely on, and is important and critical to still have this type of benefits be available. Census data helps show how many people do rely on it. In New York City, households that are receiving food stamps, SNAP, that have children under the age of 18 equals to 44%. In Richmond County, which is in Staten Island, the number of households with SNAP benefits with the under age of 18 equals to 46.2%. That is 20% of Staten Island households received SNAP benefits in 2017. That is roughly 60,000 people. We don't want 60,000 people be hungry. Having this data helps show that we need to keep and still have SNAP be funded for nutrition. Now let's look at seniors and SNAP benefits. In New York City, for seniors that are 65 and older receiving food stamps or SNAP are 11.5%. In Richmond County, for seniors that are 65 and older receiving food stamps or SNAP are 11.9%. I want to give a gentle reminder to our seniors that you can see if you're eligible and able to take advantage of this program. In New York City, less than half of the eligible seniors received help from SNAP, and that as many as 500,000 New Yorkers go hungry each month. Census data shows that it's important that you can take advantage of these benefits. Many seniors just don't know that the program exists. Now for closing, let's understand our role. We can make a difference to make sure we don't get undercounted this time. Our young generation in this future is still need guidance on how to be the best of our future. And for our seniors, well, they put a lot of hard work for all of us to be where we at now. So it's important we still make sure they get the help they deserve. We can be the change and make a difference. In this part 3, in this presentation, here is how we can. How to make a difference. To have more completion on the census, nurses and caregivers can make a difference. Not only families can help bring more awareness, but nurses and caregivers can help educate seniors that live in their own residence. You can help seniors that are more vulnerable, like hearing difficulties, or they're too afraid to allow anyone in their home to do the census questionnaire, or if the seniors don't know anything about the internet. For children, it's beautiful to start teaching them while they're young, right? The census provides coloring tools and games to start educating about what is the census. So when the next 10 years come, they be more familiar. What else can we do? Be aware that there is a problem, that people are not being counted. Explain to families that their participation will help them and their children. Get creative. Find ways to connect to families in ways that go beyond just by talking to them. Have family night, like activities that us provide to have fun with your family while learning about the census, like I suggested earlier, coloring tools and games. This can be made into a fun activity for teachers too, to students. You can get involved in your social media page as well. Use hashtags like Count Me In, Census, SI Counts when you completed your census. You can set up polls to see if who completed the census with you, or share some contact we have in our UU social media pages. We have lots of tools that you can learn from and relate with. How to complete the census. For the first time in 230 years, the census can be completed online at the website of my2020census.gov. It's available in 13 languages to support up to 51 different languages. And it can also be completed by phone, by mail, or in person. You do not have to wait for someone to knock on your door to complete it. But for seniors, I understand that it may be uncomfortable for some seniors who are simply just not used to someone knocking on your door. I understand that privacy is a big deal for our older adults, and it's a valid one. It's important to remember the closer we are to 100% count, the better we can be at designing changes in our care practices and supporting community-based interventions in ways that meet the needs. I want to say thank you for participating in this presentation. I hope you learned a lot from our seniors, from our children, of the benefits of filling out your census. I would love to hear your feedback if you had completed your census as well. You can contact us in various ways. Follow us on our social media page in Twitter, Facebook, Instagram. If you have any questions, you can email us in census@unitedactivities.org. We also have a YouTube channel in United Activities Unlimited Workforce Development. You can learn of different tools and content that you can share in your community of why the census is important. Hopefully, I can count you in to complete your census. Please comment below and let me know if you had did so.